I'm Jess De Los Santos and you're watching The Big Story. The Philippine Obstetrical and Gynecological Society wants the government to shoulder the cost for COVID-19 testing for pregnant women. The group also asks the Health Department to include pregnant women in the country's expanded COVID-19 testing. Shaila Francisco has a story.
It's difficult for Angie to be 7 months pregnant while being under community quarantine. The companies Angie and her husband work for implemented a no-work, no-pay scheme during the quarantine period. She then had no choice but to miss a checkup session last April. With mounting expenses on vitamins and more frequent sessions, she's also worried that she might shoulder costs for a COVID-19 test.
Sobrang bigat. Kasi tawag dito, magte-test ka ng ganyan. Tapos, ang dami niyo pang gastusin. No work, no pay pa. Wala talaga, walang panggastos. Sobrang bigat para sa akin. Dapat, kailangan provide nila yung panggastos.
The Philippine Obstetrical and Gynecological Society has recommended for pregnant women nearing their due date to undergo testing for COVID-19. They say studies from the U.S. and international organizations show that up to 30 to 40% of asymptomatic pregnant patients tested positive for the SARS-like disease. The group recommends pregnant women to undergo testing as early as 37 weeks of pregnancy or up to 1 week before the delivery. This will allow hospitals to prepare the facilities, equipment and PPEs and prevent transmission.
We could prepare for the newborn care. So if a mother is identified to be positive, then she will be given enough time to prepare for how she's going to decide regarding the care of her newborn, decision for the infant feeding.
The group recognized challenges including delay in test results and even the cost of COVID-19 tests. Hence, the group is asking DOH to include a test costs around 8,000 pesos.
If they are included in the expanded testing department memo, then these women should not pay anymore. Covered sila dapat ng PhilHealth.
Currently, PhilHealth says they cover costs of some pregnant patients depending on the clinical assessment.
Meron kaming question ngayon sa pending query kami, written query with DOH, sino ang papasok sa vulnerable. So that can be one category kasi for the pregnant women natin.
In case the Philippine Obstetrics and Gynecological Society requires pregnant women to undergo COVID-19 tests, the Health Department assures it can do the testing since they are part of the vulnerable population to the disease. Shaila Francisco, BR1 News.